Okay, I think we'll get started. Okay, well, once again, welcome to this webinar. We're really excited for today's one. It's about youth resilience during COVID-19, and we've all had to stay pretty strong during these times, and it's no exception for this wonderful panel that we have this morning. The next slide, please. Okay, so it's my pleasure to welcome you all to this and to welcome our wonderful group of panelists. And so we have, first of all, Stephanie Pineda, who is the Program Coordinator who manages the Global NMO Training Twinning Program and the Youth Leadership Program for the World Federation of Hemophilia. And all those great staff are currently all working from home and all still working all for you around the world. And to our youth panel, from all over the world, we have Salomón Cárcamo. He's from Honduras, and he's the youth coordinator of his member organization. He's one of the youth leaders of the Honduras-Mexico Youth Group, studying microbiology, so all the difficult questions can go to him. We have Jessica Page, who's a youth ambassador for the U.K. Hemophilia Society. And Jessica works as a primary school teacher. Her hobbies also include running and playing rugby. We have Jodarsen Arnachellum, who's a member of the Hemophilia Association of Mauritius. He's on the executive committee. He's one of the founding members of the Hemophilia Youth of Africa. He's also a member of the WFH Youth Committee and is studying in software engineering. And last but certainly not least is our psychosocial expert, Ed Kubler, who'll be known to many of you around the world, who's worked in the bleeding disorders community for more than 25 years. He's published articles in the area and is co-author of a children's book, and I didn't know this yet, Rafting Rescue, an adventure at Camp Cascade. He's also the outgoing chair of the WFH Psychosocial Committee and a long-term volunteer. I guess I should introduce myself. My name's Deon York. I'm a current member of the board of directors, and I'm a long-term volunteer for the World Federation of Hemophilia. So next slide, please. We just have a little bit of housekeeping for this today. So you're going to hear an overview of the WFH Youth Leadership Program, stories from the youth panel, tips from our psychosocial expert, and we'll have time for Q&A. There may also be some time for some Q&A between each of the presentations as well. Next slide. So if you want to ask questions at any time, you can see at the bottom of your screen, there's the chat function, the Q&A function rather. So if you go to the Q&A and you can ask a question of any of the speakers, it's useful to put which speaker you would like to ask the question for, or if you have any technical issues, you can also put them down in the Q&A and we'll try and help. Because we also have the wonderful Jessica in the back, sorry, not Jessica, I won't put that on you. We have the wonderful Zoe in the background, Louisa and Stephanie, all from the WFH and all here to help you. Okay, next slide. So if you missed some of this or had to pop out, the recording of the webinar will be available on the WFH's e-learning platform, and it's going to be made available in other languages. So I'm sorry it cannot be made in different versions of English, but it will be made in other languages so that we can make it accessible to more people. Next slide. Okay, so without further ado, I'm going to hand over to Stephanie to talk about the WFH Youth Leadership Program. Thanks so much, Stephanie.
Thanks, Deon. Greetings, everyone, and thank you very much for joining us today. We are so very excited for this first WFH Youth webinar. Next slide, please. So the WFH has many initiatives designed to give a voice to youth, to provide capacity building and empower them. These are different components of the Youth Leadership Program, and I'm going to give a quick update on each one of them. Because of the pandemic, we had to cancel or modify some of these youth activities, but I'm pleased to inform you that most of them are continuing. Next slide, please. So first is the fellowship program, which is the most popular youth program of the WFH. Every 2 years, we provide a travel sponsorship so youth could attend the Global NMO Training, the World Congress, as well as the annual meeting of the General Assembly. Since its creation, the WFH has awarded 154 youth fellowships, and we were supposed to add 26 more this year, but sadly, as you guys know, we had to cancel the World Congress in Kuala Lumpur because of COVID. Next slide, please. The WFH also organizes youth leadership workshops, and it's a fun way for us to provide intensive training for young members of the bleeding disorders community. These are the 7 workshops that we have organized, and to date, we have trained 116 youths from 75 different countries. Next slide, please. Until it is safe for us to travel again, future workshops will be held online, like this one. Of course, there are limitations to online training, but one of the biggest advantages is the WFH can provide us with a safe way to gather. And what's more, you guys don't ever have to apply for a visa to participate. Next slide, please. Despite COVID, the youth group training is also ongoing. This was created in 2017 as a pilot project, and I'm excited that it's now a permanent feature of the training program. These are the current youth group training partnerships. There's India, U.S.A, Nepal, New Zealand, Dominican Republic and Georgia, not the country, but the chapter in the U.S, as well as Honduras, Mexico. Next slide. The WFH is very fortunate to have a dedicated and active youth advisory committee. And for the last 2 years, these members have helped us so much with planning our various youth initiatives. On behalf of the WFH, a big thank you to Michael, Nicole, Jorge, Amanda, Rana, Ashrit, Jodarsen, one of our speakers, Lauren, and of course to you too, Deon. Next slide, please. And lastly, the WFH empowers youth by providing hundreds of educational materials on our e-learning platform. And what's more, these educational materials are free and are available in many different languages. We have published a specific guide for youth entitled Young Voices, and I encourage you all to download it on our website. This guide is available in English, Spanish, and French. Next slide, please. And that is it for me. If you guys have any questions or comments about the Youth Leadership Program, or if you have any suggestions or ideas for topics for the next youth webinar, please don't hesitate to email us. We would love to hear from you. Back to you, Deon.
Great. Thank you, Stephanie. Just a reminder to everyone, I do encourage you to put your questions in the Q&A. We're going to be looking at them for the entire webinar, and any number of our panelists would be happy to answer them. So thanks, Stephanie, for giving that great overview of the programs of the WFH as they relate to youth. And I hope that for those of you who have tuned in, you're able to take that information back to your NMOs and share it, because these initiatives are still ongoing. Even during these different times, we find ways to adapt and we find ways to stay connected with you all. Okay, so let's go to the next speaker now, Salomón, who's going to be talking about youth resilience in Honduras. So Salomón, the stage is yours. Over to you.
Thank you, Deon. Hi, everybody. I'm Salomón Cárcamo Bonilla, and I'm going to talk about the young resilience in Honduras, representing the Honduran Society of Hemophilia, and I'm very happy to be part of this webinar and to share our experience with all of you.
Okay, I have a suggestion. Perhaps what we could do is we could move to the next speaker, and then we could come back to you, Salomón, and then we might have some time in the background to sort out what's happening with Zoom. So if someone could advance the slides to the next speaker, and we'll go to the next speaker, and then Salomón, we certainly won't forget about you, and we'll come back to you. Okay, so lots of things are unprecedented in these times, so we have to be resilient, and we have to go with the unexpected, as you've just seen. So So now we will hear from Jessica, and we'll go back to Salomón after this. So Jessica Page, Youth Ambassador for the UK Hemophilia Society. Thank you.
Thank you. Hi, everyone. I'm really pleased to have the honour of speaking here at this webinar, especially in such unprecedented times. As Deon said, living here in the UK, I don't believe I've ever heard that word as many times as I have right now in this pandemic. So I thought it would make quite an apt name for my presentation. We're certainly navigating new waters here, and it has constantly provided us with new and exciting challenges. Next slide, please. Thank you. On the left here is a picture of my family. My mum, my dad, me and my younger brother. My dad, who's the bald guy peeking through at the back, has severe Hemophilia A, and he has quite bad joint damage in his knees, elbows and ankles after suffering years of bleeds. His disability had quite an impact on me growing up. I grew up feeling quite isolated and like no one understood what we were going through as a family. None of my friends could understand the unique pressures and challenges of the condition and what it was like to always have to watch someone that you loved in so much pain all the time. Unfortunately, as a result of contaminated blood, there were no longer any surviving haemophiliacs in our family, and we had no other links to anyone else with a bleeding disorder. I often felt like I had no one to talk to about what I was going through. I wasn't diagnosed until I was 18, and when my carrier status and factor levels were tested. It showed that my factor levels were low enough to be diagnosed with mild haemophilia A. On the one hand, I was relieved to finally have an explanation for all the things that I'd struggled with growing up, such as heavy periods and injuries that just took too long to get better. But I felt even more isolated because I didn't know anyone else like me. I didn't know who I could turn to. In 2018, I saw a Facebook post from my NMO asking for help in the office. So I made the journey into London just to help out with some paperwork. That was all. And only a few months later, I was a fully fledged youth ambassador, just signing up for everything that I could. And I honestly couldn't have been more grateful, because joining my NMO helped me find a family. I finally found people that understood me and just got me. Next slide, please. Thank you. The Hemophilia Society puts on a full calendar of events for our members every year, and knowing that this was the place I belonged, I was keen to be as part of as much of this as I could. My first task was youth camp last summer, which was attended by over 40 children across the UK with bleeding disorders and their siblings. And knowing that I was a primary school teacher, I was thrown into the deep end and asked to be a leader of one of the groups of the younger children. I had so much fun, but I honestly think I got about 20 hours of sleep across the 5 days. I was absolutely shattered. Later in the year, I volunteered at my first newly diagnosed weekend, which is for families who have recently received a diagnosis of a bleeding disorder. At these weekends, I spoke about my experiences growing up as a girl with haemophilia, alongside experts of bleeding disorders and other youth ambassadors. Having seen how the Society supports our members firsthand, I perhaps rather stupidly agreed to run the London Marathon to help raise money so that they could continue doing the work they do, despite only ever really running about 5K. I'm really lucky to be part of a really impressive and good-looking bunch of youth ambassadors, which you saw on the other slide. The youth ambassadors help support events that the Hemophilia Society runs throughout the year, as I've mentioned, but last year we received training to help give us the skills and confidence we need to best support the society and our community. Earlier this year, we were keen to start our own projects, such as a big push on talking about mental health in relation to having a bleeding disorder, and I was particularly interested in our Talking Red campaign, which focus is to raise awareness of bleeding disorders in women and improve our outcomes and diagnosis. Another youth ambassador and I had just created a plan for this when lockdown struck. Next slide, please. Thank you. Concerns about the coronavirus started in February in the UK, and some of the Hemophilia Society's events, such as our Talking Red weekend, which I was really looking forward to, had to be cancelled over safety concerns for our members. Unfortunately, the coronavirus really hit us hard, and the UK had to go into full lockdown on the 23rd of March, and our NMO staff started working from home. All of our vital fundraising events that our charity rely on, such as our London Bridge Walk, had to be cancelled, and we saw our big 70th birthday celebrations cancelled too. Many of our more vulnerable members of the community, such as those infected with HIV, had to completely shield, and many of them still are. Personally, for me, lockdown brought back a lot of those feelings of isolation that I'd felt before being a part of the Hemophilia Society. It was really hard to be apart from something that I felt like I'd only just started being a part of. As a primary school teacher, I had to start homeschooling my class by sending out weekly home learning sheets and marking work online, which was unlike anything we had ever done before. My school remained open as we provided childcare for the children of key workers. It was a really hard time for my class and their parents, and I had to spend a lot of my time on the phone supporting them. I decided to try and focus on my fitness for the London Marathon, which was still going ahead at the time, and focusing on the things that were in my control at a time where I felt like nothing was. Even though we're no longer in a full lockdown now, things are still really quite restricted and the rules keep changing. It's still quite far from normal too. To date, we've had over 40,000 deaths from the virus in our country, and even now that lockdown is lifting, nearly over 2,000 people are being diagnosed every day. Next slide, please. Thank you. But it was in this lockdown, this unprecedented time, that I truly learned the true resilient nature of our community. Like a real family, we continue to rally around each other in whatever way we can. Members of the community organise their own fundraising events, and everyone that signed up to the London Marathon is completing it virtually in October. I started my own fundraising challenge of a virtual relay where myself, friends and family collectively ran over 700 kilometres in April to raise money and awareness of bleeding disorders. The Hemophilia Society has already started a community project called Knitting for Uganda, where members of our community have been knitting squares which can be turned into blankets for people with bleeding disorders in Uganda. Our staff continue to work hard too, and have published more information booklets, such as our Back to School booklet, which covers how bleeding disorders can best be managed in an educational environment. We have also started our own webinars called Bleeding Matters Live, which take place about every other week, and it covers a variety of topics, such as the public inquiry and how we can support children best in our community. We also make sure that every person with a bleeding disorder continues to receive a good standard of care, pandemic or no pandemic. Next slide, please. I think in the UK, we have learned a lot during these unprecedented times. We've definitely learned the true value of our National Health Service, what makes a good leader, and more often than not, what doesn't. I think what I have taken most from my experience as lockdown is just how truly powerful our community is and how much potential we have. Even in the darkest of times when things were cancelled and rules were constantly changing, we relied on the very foundations that our NMOs are built on, that we are a community, a family of people that are there for each other. I mean, even now, this webinar, we found a way to connect people all over the world. My advice to anyone else in similar situations is just to focus on what you can control and what you are capable of doing. Continue to engage with your NMO in whatever way you can. I'll finish with one of my favourite quotes from Ralph Waldo Emerson, as I think it perfectly sums up the spirit of our community. What lies behind us and what lies before us are tiny matters compared to what lies within. Thank you so much for listening.
Thank you so much, Jessica. That was a very motivational talk, and I think that many of us can resonate around the world with many of your sentiments. So thank you so much for that. And of course, there'll be time to ask Jessica questions and the rest of the panel at the end of this session. But I think what we'll do now is go back to Salomón, and hopefully the internet connection will be working well, and we'll be able to hear from Salomón. So just bear with us for one moment while we go back to the other slide set. And just while we're doing that, there was a comment about Stephanie's presentation about the Youth Fellowship And there was a suggestion about having a youth fellowship in 2021. And I answered that live, just pointing out that that the youth fellowships are available for each World Congress of the World Federation. So all going well, the next World Congress will be in 2022. So, you know, who knows what the world will be doing even in a year or two, but all going well, it'll be in 2022. And there'll be that opportunity once again for NMOs to submit applications for youth leaders all over the world. So Stephanie, was there anything else anything I missed, anything you'd like to add?
It's perfect, Deon. So what we want to just reassure the people, well, first of all, thank you very much for those of you who took the time to, you know, apply and gather all your application documents for the Youth Fellowship in 2020. And we haven't forgotten about you guys. So we don't want to give information yet right now because, as you know, COVID, there's so many uncertainties. And so we, the Youth Fellowship is every 2 years, but next year we will have a regional Congress. So we're still exploring our options. And once we know if everything is going ahead, we will then consider all our options to see what we can provide for the Youth Fellows. Yeah, right now we don't have any concrete information to share because there's still so many things up in the air. But once we have more information, for sure, we will contact you guys. We will inform you through our social media or send you guys an email as well. Thanks.
Great, thank you, Stephanie. Okay, so now we're going to pass on to Salomón. Round 2. Thank you.
Thanks, Deon. Hi again. Sorry, I have technical problems, but I will start again. My name is Salomón Cárcamo Bonilla. I'm going to talk about the young resilience in Honduras. I'm representing the Honduran Society of Hemophilia, and I'm very happy to be part of this webinar and to share our experience with all of you. Next, please. So who I am? Well, I'm 24 years old. I have hemophilia B, and I was diagnosed at the age of 2 years. I'm a student of the degree in microbiology at the National Autonomous University of Honduras, and also I'm working with the Antimicrobial Resistance Observatory of my university. I'm currently doing my social service, so I expect to finish this November and start to work with my organization, not only as volunteer, also as healthcare worker. About my family, I can mention that I come from a very big family. I have three sisters and 3 brothers, 2 of them also with hemophilia B. And if I need to choose a hobby, it will be maybe watch sports on TV, like soccer, but I really enjoy also to spend time with my family and friends. Next, please. So for those who ask, where is Honduras? Well, Honduras, it's a little country in Central America. Central America is the region below Mexico, and Honduras is between El Salvador, Guatemala, and Nicaragua. We are a tropical country very famous by our food, touristic places, and our biodiversity. Next, please. Okay, and how's hemophilia in Honduras? Well, we have 388 patients between hemophilia A, hemophilia B, von Willebrand disease, and factor 13 deficiency. The country is divided in 18 regions, and we have hemophilia treatment centers in 8 of them. So maybe some of you are asking, how do that people who live in other regions? Well, in Honduras, we don't have prophylaxis, so you can't go to the hospital and get medicine to your home unless you are sick. So we work constantly to receive donations. We receive especially from the World Federation of Hemophilia, and we try to put those donations in the home of these people. By the year 2005, we had only 1 hemophilia treatment center for all the country. And to give you an idea, if you see the first region on your right, it's gracias a Dios. The only way to get inside or outside this department is by helicopter or boat. So you can imagine how difficult it was to be a person with bleeding disorders at that time. Now the situation changed and we have more hemophilia treatment centers, but we expect to one day have 1 hemophilia treatment center in every region. Next. Before the pandemic, the activities of the Honduran Society of Hemophilia were focused on attend our principal objectives. Those are to get better access to medicine, talk people about hemophilia, and the social inclusion of our members to the society. Because we think that it's not only to have medication in our homes, it's also to have a good quality of life, make friends, get a job, get married, basically have a normal life. And we made activities like camps and workshops to accomplish those objectives. And also we had the opportunity to start a twinning between the young group of the Hemophilia Federation of the Mexican Republic. And we had the opportunity also to make a psychological workshop with them in February. And we had more activities, but due to the pandemic, those were canceled. Now, in Honduras, we have 62,526 cases and 1924 deaths. So we have a fatality rate of 3%, and healthcare system has a lot of carencies. So basically, the action plan to prevent the spread of the virus is the use of face masks and ambulatory restrictions in the country. So in March, we started quarantine, and until now, we are trying to open our economy, but it will be a very slow work. Next, please. Now, as I mentioned, because of the pandemic, we cancel activities, but we try to adapt us, and we made activities to accomplish our same goals. For example, we made webinars to talk people about different topics like inhibitors or von Willebrand disease. Also, as part of the training, with Mexico, we have the opportunity to make a second psychological workshop. And also, we are working on application smartphones, as you can see in the screen. And with this application, we hope that people will have access to information about hemophilia and other bleeding disorders in their cell phones. They will have access to videos and other kind of educational material. They also have a map of the hemophilia treatment centers in the country. This application doesn't have a release date yet, but it's almost ready. So we expect to release very soon this application. All these activities that I mentioned was not in our original plans, but we try to adapt us and make these activities was our way to overcome the pandemic. And if I want to say also before in my presentation that if there is a lesson that we learn of this pandemic is that we must continue to evolve, because today we are in a century with constant changes in technology, and we need to learn to take advantage of this. Before, we had to go to television or radio to talk people about hemophilia, but now we are on a click of the instance of that. So if we learn how to use these tools on our favor, we will reach more people. And you don't need to be a genius of technology for this. You only need to have the determination to do it. And if you are here today in this webinar, it's because you have it. So next, please. Gracias. Thank you very much. And I hope to see you again in another event.
That's great. Thank you so much. And I think that many of us can relate to the need for us to adapt so quickly and use technology. Maybe some of us were lagging a little bit behind. And so now really no one has a choice. We all need to use the technology. So I appreciate those first two presentations have been fantastic. We've been looking at the Q&A, and there aren't too many questions at the moment specific to the presentations. So I just encourage you, please, to submit your questions and we can address them at the end. There've been a few medical questions around treating bleeding disorders. We can't address these on this webinar, but in addition to getting in touch with your local treatment centre, or if you don't have a local treatment centre, there's also the e-learning platform on the website of the WFH, which has the answer to a number of the questions that I see popping up on the Q&A. Okay, so we'll move straight on to Jodarsen, who's going to be talking about overcoming the COVID-19 pandemic. Big topic, over to you.
Thank you, Deon. Hello, everybody. Thank you all for coming today. First, I will quickly introduce myself. I'm Jodarsen Arnachellum. I'm 30 years old, and I have specialized myself in software engineering. I am from Mauritius, a small island in the Indian Ocean, about 2,000 kilometers off the southeast coast of the African continent. And in my family, there's only me and my younger brother that has severe hemophilia A. When I started preparing for this webinar, I was reminded of when I almost died as a baby of 7 months old. So before I start, I would like to share a quick story told to me by my fabulous mother. I was admitted in a very critical condition at the hospital, and the doctors announced to my parents that I would not survive the night. But to the astonishment of all the doctors, I refused to die. And several days later, fortunately, I was diagnosed and treated with transfusion of cryoprecipitate. During my life, I came back from the jaws of death a few times. And my mother actually joked with me whenever I'm annoying to her about the fact that I didn't die and grew up just to irritate her. From what I remember from these near-death experiences is that I never give up and always hold on to life. And I believe even as a 7-month-old baby, I loved life. And as long as I was breathing, there was something very simple but powerful that always helped me. And that was hope. Hope is something that we all need during this pandemic to give us strength and courage to adapt ourselves to the new normal of this ongoing pandemic. And I'm looking forward to bring hope to the youths in the bleeding disorders community by the end of my presentation. Next slide, please. These are the topics that I would like to discuss today. Next slide, please. I'm going to talk about my NMO. I'm going to share some details about our activities that we do and my involvement up to now within the organization. In Mauritius, we have a population of about 1.3 million. And in my NMO, we have only 261 members on our registry. We have 97 patients that suffers from various bleeding disorders. We also have 40 youths on our registry, and 32 of them are active members within the HAM Youth Group. Activities that we do at the NMO are fundraisings, patient outreach, camps, workshops, trainings, group psychotherapies, physiotherapy sessions, social gatherings like the World Hemophilia Day celebration, awareness campaigns, and advocacy. On the slide in the middle, actually, you can see a picture from the first youth camp and self-infusion training that we did. My involvement in the organization has been with public collection or SMS donations, for example. I have set up the youth group and youth committee, organized the first youth camp and several youth activities. I'm also a social media and website administrator for HAM. I help with AGM preparations. I also do public speaking and media campaigns like TV or radio interviews. And lastly, I have been a WFH Youth Fellow in 2018. Meeting with other youth leaders from around the world has been an incredible and unforgettable experience for me. And it was the first time I had seen so many people coming together or getting involved with the hemophilia cause. It shocked me and made me realize that I was not alone, and I had, like I always believed, and actually there was a huge community of bleeding disorders that is here to help and support. Next slide, please. These are pictures, several pictures from HAM youth activities. The last event that we did was an outing in December last year Since we are a new youth group, the activity was mainly going out, getting to know each other and having fun together, so as to strengthen the bonds that we have among the members in the group. On the right, these are pictures from the WFH Animal Training and Congress in 2018. I have actually highlighted two pictures in the center. Both are actually from youth meetings. The first one from the right is youth leaders from around the world. And the second one from the left are youth leaders from African animals specifically. This was actually the very first meeting of the Hemophilia Youth of Africa. Next slide, please. What is the Hemophilia Youth of Africa, or HYE? HYE was founded with the view of addressing challenges faced by youth with hemophilia and related breeding disorders in Africa in their everyday life. HYE wants to establish a healthy learning environment to ensure the continuity of youth structures within existing national member organizations. Our vision is to impart skills and knowledge to the youth to improve their participation in their animals. Prior COVID-19, our strategy has been making use of online tools and having online meetings after the Congress. We actually received a development grant from WFH for a Youth Leadership Program last year, and HYE continued to grow. The first phase of the project was to reach out to Anglophone animals first, and we have received a great support from 10 animals out of 15 actually. They nominated 2 youths, from each respective animals. And we also have 15 youth volunteers that are within our network that participate and help us. With what we are doing, we want to inspire other youths in the bleeding disorders community that no matter what challenges you face, you can overcome them with the support from others. We hope to inspire other youths from other regions of the world to engage themselves too. And I believe from around the world, youths from around the world, we can collaborate online. Next slide, please. These are pictures from our first leadership workshop, a youth workshop that was organized by youth themselves. But it wouldn't have been possible without the support of animals and so many people from the community, especially my animal, the Hemophilia Association of Mauritius, as Mauritius was the host nation for this first training. I would like to seize this opportunity to thank Ham, the executive member, and the staff. What I loved about the first training is that we had many women that were involved as participants as well as trainers for this first training. Next slide, please. COVID-19 in Mauritius. Actually, the success of Mauritius in managing the COVID-19 is because we acted very early. Very strict restrictions were imposed by authorities in the beginning, which was very difficult for everybody. But being a small island, closing our borders has helped a lot. We went in lockdown in mid-March, and there was no cases for local transmission that was detected since 26th of April. Since then, all the cases that were reported were imported from passengers who were repatriated to Mauritius. The lockdown ended in end of May, but some restriction was still imposed, and the lockdown was lifted in mid-June, and everything reopened: beaches, market, gyms, public places, but we still had to wear masks and keep social distancing. Schools reopened by 1st of July, but by now, everything has become relaxed and back to normal. Even social distancing is no more enforced, and we're just wearing masks in public. But it has been decided that we're going to maintain our borders and air traffic closed until end of October. Next slide, please. Activities that we have been doing during the pandemic. While the COVID-19 was unprecedented and nobody really knew how to deal with it, but from the challenges actually came opportunities. In Mauritius, we started using platforms like WhatsApp a lot. Several groups were created to connect everybody, but our main concern was to ensure that everybody had access to the treatment and ensure we could address any emergency effectively. It became very difficult to ensure timely procurement of factors too, as we were going out of stock. But thanks to a great team in Mauritius that managed to overcome any difficulties that we were facing. the groups that we created actually helped a lot. It connected us. People were sharing jokes, games, positive messages, and motivational memes daily. One positive outcome for us is that we have been fighting a lot for home therapy. And the blessing during the COVID-19 is that it was made easy for us to get our patients and kids on a pilot home therapy project. And post-lockdown, last week actually, we started self-infusion trainings that were going to give certificates to our patients. And this will lead to monitoring of patients on a home therapy. And if successful, we will be able to bring patients that need home therapy. Next slide, please. If we have to adapt ourselves to the pandemic, we have to make use of tools, and there are several available free online tools that we all can use. For example, on this slide, there's an image that was created by one of our staff from HAM for the World Hemophilia Day. And we posted it on our social platforms, and we have also encouraged all our members to share it for the next networks so we could reach out to many people. Next slide, please. Now I would like to share some lessons learned and advices with you all. When everything shifted online, actually, there was a huge increase in online activities. I had so much notifications and messages that it became impossible for me to cope with it. There was school, lectures, work, animals activities, friends, families, everything was online. And it can be very overwhelming and lead to burnouts. And what I learned is that finding the right balance between online interactions and time for yourself can help a lot. Being in lockdown isolation does not mean that you have to be always online and stay focused only on online activities. What I suggest is that you do things that you love. You can paint if you're an artist, you can dance, you can sing, you can play an instrument if you're a musician, you can cook things that you enjoy to eat. Do not stay always on your screen. I suggest that you allocate time for it and find time to do other things, like maybe a quick walk in the garden if you can. Personally, I stayed isolated in my room for a long time, and I found out that by going out and getting some sunlight, it actually improved my mood a lot. So these are things that you can do. If you can go out and get some sunlight, it can really help a lot. And I was also going to talk a little bit about support groups online that we did with HYA, with psychologists, and meditation. But I think the next speaker is going to speak about that. So this will be all for me. Next slide, please. Thank you very much for your attention.
Great, thank you. Thank you so much, Jodarsen. And there's a lot of great tips in there. Particularly, we all spend, well, many of us spend a lot of time now either looking at a computer or on a phone or involved in some way with technology if we're able to access it. And it's really important to take a break from all of that. I can certainly relate to that one as well. So thank you. So now I'm going to pass over to Ed, who's going to talk about staying positive and optimistic during these times. Thank you.
Thank you, Deon, and really what great presentations before this. I just made some notes while I was listening about hope and things that the foundations are doing. So it's been really wonderful to be a part of this. Next slide, please. Here's just some areas that I'm going to cover, and I'll move through them pretty quickly. It's just today was just to give you an idea of some things to think about for being optimistic, staying positive, and we'll end with a little meditation that hopefully can bring us all to a place of feeling centered. Next slide, please. So staying positive, I think it's really important that we learn how to do this. It's actually can be a learned activity. For some people, they seem to have a positive outlook. They always seem to be upbeat, and but that's not all of us. So it's about having a perspective, and that's part of something we can learn, we can practice. And so I would ask you, what is your perspective on being positive? Do you feel like it's something you can do? Do you practice it? Do you understand what you can do to remain positive when things look pretty dark or difficult? Positive versus real. I want to say something really quick about that. They're two different things. I think part of being real is staying in the moment. Right now we live on a planet with COVID. Things can look pretty crazy and dark for people. It can be a really challenging time. And that may be real. But what we can do in that reality is find ways to be positive. Find ways to take what's going on around us and turn it into something different. And we do have the power to do that. Some of that is just holding on to old truths, having some things come up for us that come from our history. I think it was mentioned sometimes triggers of what's going on right now can be an issue. So just to really think about what are some of the things that you may be holding on to that keep you stuck or keep you thinking in a negative way, and see if you can't, in the next few slides, think about how to change that. Next slide, please. So strategies for changing our view. That's really, really one of the things I think right now the focus is. Our lens is on COVID. It's our planet, it's what's happening. And so if that's all we're seeing, if that's all we can think about, it's really easy to lose that ability to move from a place of feeling overwhelmed to a place of feeling accepting and being able to connect and be a part of what's going on in a way that is not going to hurt you or become overwhelmingly negative. Some people see things in black and white, and I invite people to look for things in color. And it's really a task in being able to change how you see the world, how you see what's going on around you. Do you see a glass half full or half empty? I'd like to remind people that when you sit in a different seat, and I wrote up here on the slide to move your chair or move to another chair. And what that means is, do you always sit in the same place in your home? Do you always do the same things where you always get the same view and perspective? Try sitting at your dining table in a different seat. Try sitting where you watch TV in a different chair. Try doing some things where you change the perspective right in front of you and look around and see what might look different. I think you would be surprised. Next slide, please. So I love this. I wanted to put up a rainbow and a unicorn just to sort of remind us life is not always rainbows and unicorns. For some people it can be. For some people that's how they see their world, and I think it's absolutely amazing, but not for all of us, and I think that's okay. But how do we strive to get here? How do we find our lives to be in a more positive place, in a place that has more light and magic maybe and creativity? Next slide, please. So life has a lot to offer, and I think that's part of what we need to remember is, you know, we have lived for as long as whatever age we are. So really, if you can see something, if you've experienced it, if you can imagine it, then it all has possibility to be what you want it to be, even in a world that's changing in a way that is not always positive. It is true that life can hurt. We've all had experiences where we might have had our hearts broken, we've become afraid, maybe even feeling hopeless at times, certainly with a diagnosis, with lack of treatment in some countries, and now with COVID-19. But what I want to remind you about is you have the choice to move from that place. So if you feel stuck, if you feel like some of these words that I just said or that you see on the slide here, you can move from that place. And think about what that means, to be able to just move from a place of feeling stuck to a place of changing and looking around and seeing something in a different way. Life has endless choices, and that is true. Next slide. The power of choice. I was thinking about this, and what I love about it is a superpower. I really believe as human beings, one of our superpowers that is probably underestimated and sometimes maybe underused, but it's our ability to choose to choose something different. If something isn't working, to choose something different. And I think if you think about it, you have been choosing your entire life. It's a skill you've been honing in on, something you've been doing since birth. When your parent may have said, do you want this vegetable or this vegetable for dinner? And you got to choose. Or do you want to wear your red shirt or your pink shirt? You got to choose. So we've been choosing our whole life. I also want you to know that if you choose nothing, if you don't make any choice, that is a choice. And that's really important to understand. Next slide, please. 3 things you can do right now. I wanted to think about, if I could tell you 3 things. Choose to stay positive. If life gives us choices, then choose to be positive. A conscious choice, I'm going to be positive today when you wake up. Do something different. It's a new day. Do it different today. Do something different tomorrow. Change the way you are walking through your life with everything going on around you. And then identify 3 things or people that you are grateful for. There's nothing like gratitude and remembering why we're grateful for just waking up, in some cases, for being able to do something, for hopefully what's happening around us, we can still find our way through it, to begin to be grateful. And I would invite you to get a piece of paper and a pencil whenever you have a moment and write down today 3 things or people that you're grateful for. Next slide, please. So I thought it would be important to mention about staying grounded. And what that means is when we are grounded within ourselves, when we know who we are, when we're clear on what we're doing, even in the days we wake up a little bit unsettled or confused, we're still grounded. And by doing that, you look around and see what's going on around you. When we're grounded, we can fly as high as we want to. We can be as creative and as imaginative as we can think of. So it's really important to be grounded, whether that's with your family, within yourself and your beliefs, but to think about what grounds you, what keeps you solid, and then from there allow yourself to move and grow and change. Next slide, please. So I was thinking about a meditation. 3-minute meditation every day when you wake up or at some time in your day could be really valuable. And it's a moment to just sort of connect within. Next slide, please. So here's one that I put together just from some work I used to do and really trying to keep us in the moment. And I thought we could all do it together in the next couple of minutes. So if you would take a moment while you're sitting here in front of your screen and listening, and just close your eyes. You don't have to look at anything, just listen to my voice. Take a deep breath, and then just let it go, and another deep breath, and just let that go. And on your 3rd breath, as you begin to exhale, just let your body relax. In the chair you're sitting, or if you're on a sofa or at your desk, just let your body relax. Your eyes are closed and your breath is just flowing naturally. I want you to listen to the beating of your heart. So you have to take a breath and follow that breath down inside until you can hear your heart beating, that you can allow your breath to move in and out, and both have their own rhythm within your body. And as you take another breath in, just allow any thoughts that you have going through your head just to float away. Thoughts of maybe this is silly, or I don't usually can relax, or whatever you're thinking, just imagine those like clouds and they just pass, but stay connected to your heart beating and your breath. And then just take another breath in, nice and easy. And I want you to notice if you have any stress in your body right now. Are there places that you hold stress? In your neck, in your shoulders, in your back? Does it cause you headaches, tension around your body? Just notice right now as you keep breathing in, do you have any stress in your body? And when you take your next breath, I want you to go to where the stress is. Go inside and find it, whether it's your neck, your back, your shoulder, your head. Just find it as if you could move up right next to it. And what I want you to do is just begin to rest there. And as you breathe into that area of stress, imagine it lessening and breaking up. And with your next breath, it starts to move away. And you begin to settle in. And as you take another breath, I want you to imagine a small white light in the center of your body. Take a moment and just breathe that light in. And with your breath, I want you to feel its brightness. Take another breath in of this beautiful light. This is your light, the light of who you are, and it's been with you since you were born. So take a nice breath in and just feel and see the light within you. And as you take another breath, I want you to imagine that light expanding inside you and let it fill your entire body. Let this light reveal your power and your truth. Let this light help you remember who you are. A beautiful light in this world. You came that way with gifts and talents. Take a moment and just breathe in and feel the light of who you are. And as you move through the rest of your day, and as you think about what's happening around you, let this light be your guide. Let it walk with you. Let it remind you that you're more than what's happening around you, more than a pandemic, more than a bleeding disorder, more than some of the stress in your life. Let this light remind you who you are. Powerful, kind, strong, positive, and filled with possibility. This is your light. Take it into the world and let it be a beacon of hope. Let it be a beacon of strength and positivity for you and others. Take a nice big breath into your body right now and just allow that breath to carry you back to where you are, sitting at your computer, watching this presentation. You can open your eyes, but I want you to remember who you are, an incredible light in this world. Next slide, please. If life is a banquet, then fill your plate and taste everything. Next slide. Thank you, and I hope you practice the meditation and walk with the light inside of you. It's been a pleasure being with you today. Back to you, Deon. Thank you.
Great. Thank you so much, Ed. Now I feel very relaxed. I'm sure that many of you do as well. But we can't stay too relaxed if we're on the panel. But Ed, I do have a question that's come in for you just before we move on to the panel. And that is that, that I have to convince myself to be positive. And when I do that, it has the opposite effect. So what would you recommend?
So make sure I understood you, Deon. You have to remind yourself to be positive, but it has an opposite effect.
Yeah, that's the question that's come through. Yeah.
It would be helpful if I had an example of how it turns. I'm not sure if you're trying to be positive and practicing that, then I'm not sure where it turns to go in a different direction, unless there are things happening or things that keep running through our minds that overpower that need or want to be positive. So without a little bit more information, most of the time when people really work at being positive, it doesn't mean everything goes well, and it doesn't mean it's a magical world and perfect. Other things can come in. I think what it reminds us is that we have to keep being positive through that. So we may be able to stay positive for 5 minutes, and then our minds start thinking about something that's challenging or hurtful. And we have to remind ourselves that I need to move through this. I need to try to be in a more positive place and keep practicing that. It's like anything, things can overwhelm us. But if our goal is to keep moving that way, I honestly believe within some time, we actually become more positive than we do with the negative stuff interfering.
Great, thank you so much for that. So now, if all of the panelists could turn their cameras back on so that we can all see your faces, and we'll go through some of the Q&A. So we have Q&A popping up at the bottom of the screen and to the right on the Zoom webinar chat. So if you have a question, it would be great for us if you could put it into the Q&A function at the bottom of your screen. So having a look at some of these questions here, I think I'll start with one which is for all of the panelists, and it comes from Alex from the Hemophilia Society of Jamaica. So his general question is, what are some of the challenges you have experienced as it relates to the use of technology in advocating for haemophilia recently? So I'm just going to go in the order that I can see on my screen. So Jessica, that means that we start with you.
So we're still finding difficulties with technology, even though we're obviously quite a well-developed country. Technology is still something we're struggling to get a hang of. It's still, making sure that everyone's got the same knowledge of the same technology that we're trying to use, because kind of during COVID, everything kind of blew up. I didn't know there were so many like video services and things like that. And I think it's just about picking the one that works, because there's just been so much that has been published online. It's trying to make sure that the advocacy stuff that we're still trying to do is still getting seen by people that need to see it, and trying to use like social networking and things like that to try and boost what it is that we're doing.
Thank you, Jessica. Jodarsen, do you have something to add to that? I'm putting the panelists on the spot.
Yeah, actually, what I would like to share about challenges that I have been facing, especially working with youth, because there's most of the people that we work together are from developing countries, and we don't often realize when we come from developed countries that we have a 24/7 Wi-Fi connection in our house and even in public places. But people from developing countries, it's actually difficult for them. They have poor networks, and this is a big challenge, communication. For example, if we have to have a meeting with the youths, we have to inform them prior, 2 weeks before. And if we have to get everybody present, there's a cost for that. They need to buy their data. For me, it's actually very simple. I have it at home every day. But these are the challenges that I feel that, especially in the African regions or any developing countries, they might have.
Thank you. And Salomón.
Thanks. To be honest, I have a lot of challenges using technology because I'm really not so good, but I have a lot of brothers, so my brothers know a lot of different things, and I'm learning a little by everyone. So I learn one stuff for one brother, other for other, and when you take all of this, you learn a lot of things of different, areas. And as one friend told to me once, that you learn something one day will not make you an expert, but if you learn something one day for 1 year constant, you will learn 365 things. So at that time you will be an expert. So if you have problems with technology like me, you only need to have is to learn little things one day, learn other little thing on the next day, and in 1 year you will be an expert in the area that you want.
Thank you. And Ed, do you have some comments to add in here? Just got to unmute you.
Sorry about that. I thought I clicked it. I was just thinking, Deon, that it's a new normal in our world, and how we and foundations advocate and how they move forward to everything from funding to treatment to the things they need to do is taking on a whole new world. The ability to sit in front of somebody or to actually have a dialogue or go for coffee, and the things that happen are now moved more to technology, like Zoom meetings and sending messages. And so I was just thinking about that it's going to take, and I think the answers that were already given were really good. It's going to take some practice. We're going to have to try some things different and see how we can keep meeting our goals of what it is we want to accomplish in the new technology and in the new world of technology that's even bigger than it used to be before we've had to change with COVID. So that was just my thought on that as I was reading the question, that it is going to be different, but it's different for all of us. And I hope as we learn some effective ways to do some of these things, that we share them with each other, that we share the knowledge and the learned experiences, and maybe save someone else a lot of legwork.
Great, and great comments from all of the panel. And I just wanted to add as well that I think that what we all need to be mindful of, and particularly when thinking about the World Federation, you know, is that part of the role is for all of us to help connect one another, whether it's our NMO or whether it's the Federation. And we've also got to be mindful of the digital divide. I think that, you know, not everybody has access to the same technology. We know that globally, many people have access to devices, but Jodarsen's comment, you know, some people don't have the credit on their device to be able to access the information. And so, you know, as we move in supporting one another around the world, we have to think about that, about how we can somehow bridge that gap. We always talk about closing gaps in terms of treatment, but there's also a technology gap to close to enable that to be possible. So they're all great comments, and thanks to the panel. So I have a question specifically for Jessica that I saw pop up earlier, and it's from Irene. And it says that in your presentation, you mentioned that your life changed after joining the U.K. Hemophilia Society. So what's your advice for other haemophilia patients and people with other bleeding disorders and their families from developing countries for them to be involved in their NMO activities? What's your advice for them?
I think generally for anyone, being a part of your NMO is incredible. It's empowering. It gives you the information that you need to advocate for yourself as well. The best thing you can do is participate at a level that is convenient for you and that works for you. And I found in my experience, if there's something that you want your NMO to be doing, if you suggest it, chances are they'll come up with something, or you could be the person that really kind of creates that and pushes that forward. So in summary, just to do what works for you, and definitely from a younger age, I think that would have made quite a difference to my life if I'd been engaged at a younger point.
And as I'm scrolling through, since Jessica, you have the microphone, this is another one for you from Bradley. Do you refer to yourself as a carrier or a person with a bleeding disorder? And how do you think that affects how healthcare professionals see you?
At the moment, I predominantly see myself as someone that does have a bleeding disorder, because it does affect me in my day-to-day life, and I have to take medication and things like that to help me manage my condition. Healthcare professionals do tend to see me as a carrier, which is something that the Talking Red campaign is really working on to kind of increase that awareness as well. But yeah, I would consider myself as a person with a bleeding disorder. Thank you for the questions.
Great, so we'll take the heat off you a little bit, Jessica, and we'll, I have a question here for Jodarsen, and it's from Irene as well. Irene, you're being very good on the questions here. They're saying in this that they realise that that HAM has achieved a lot as an NMO in a very short space of time. So what would you say is the perfect recipe for other young people to achieve the same success?
I think that young people are the ones that have novel ideas. They always want to innovate. So you need to advocate within your NMO that they give space for youth to have a voice. And the best way to do that is that you have youths that engage themselves and go for election and try to be on the executive committee. The leaders in those NMOs should be open to give this opportunity to the youths, because this is the only way that you can really advocate in your own community within the committee members and try to bring your ideas forward. So I believe that if more youth engage themselves and try to be on the committee of the NMO, this can actually help bring innovative ideas that can bring success to NMOs.
Great, thank you. I have a question for all of the panel, and that is, you know, I think a lot of the comments that we're getting through are really about sort of, you know, the very topic of this webinar today about resilience. And I'd just like to hear from each of you about what tips you'd have for those who might be feeling isolated at this time. I mean, we know that living with an inherited bleeding disorder for some around the world can be a very isolating experience at the best of times, and now we are in very different times. So I'd just be really interested in your reflections on that. So perhaps this time we'll start with you, Ed, and we'll work our way down the camera. But you're going to have to unmute again. I'm sorry to point that out.
No, thank you. That's okay. I get excited. I was saying I was reading some of the questions here that fall into this category, and the idea of resilience. And I think when I think of resilience, either the work I do with people or with myself, it's that ability to bend and not find yourself breaking. It's that place where I think for myself, I'm able to shift the way I can see something. I'm able to reframe it so that it doesn't break me. And sometimes that means I have to put it down for a while and move to something else because it's overwhelming. And sometimes I can face it head on and try to learn something from it. I think part of resilience, and people who do it so brilliantly, is they just have this ability to see what's coming and be able to move it to a place of manageability and be able to know when to put it away for a while and then come back to it. So I think it's changing in the moment when we need to. And I tried to say that a little bit about moving our positions, sitting in a different chair. Some of those things, they allow us to think differently. And I do believe, and the work that I've done with some people, is that a creative part of our brain goes beyond that first decision of what do I do now, and then we try something. And what I say to people is, then what would you do? And after they give me an answer, then what would you do? And when you move to 3 or 4 of those, then what would you do? We actually move to a place where we start thinking in a creative way that we may not otherwise get in touch with. So it's a big topic, and it's very individual, but I think hope and resilience come from within. So being able to tap there, no matter what's happening around you, and try to reframe it in a way where you can find a place to manage is really what came to mind when you were asking that, Deon.
Great. So thanks, Ed, and another member of the panel, maybe Salomón. What do you think about trying to help with people's isolation during this time? I'm sorry, you're also muted. You're going to need to unmute. Sometimes on these webinars we have bingo where how many times do you say you're on mute? I've said it a few times today, so I should have started with that. Salomón, over to you.
Sorry, okay. When the humanity are in these circumstances, always learn how to overcome these problems. I think that during the pandemic in the bleeding disorders community is not different. I think the young people have the tools and they had the motivation to overcome every problem. They can do it. That we were in a pandemic or a lockdown, as you call them in your country, doesn't mean that you will be in your home only waiting that this ends. You can do something in your house, and maybe you have an idea. You always go to the meetings of your NMO and think maybe this will help your organ. Tell the people your idea. But if you have this idea, you can tell them now. This is the moment that you can. Sorry, I hear something. Okay. This is the moment that you can do something for your organization. You can take the initiative.
Anything to add there, Jessica or Jodarsen?
I think all I'll say is that I remember when I was talking to Stephanie from WFH, and she said that something they keep saying is it's physical distancing, not social distancing. And I think that's so important for us to remember that, yeah, we are supposed to be staying apart right now, but actually I think it is more important than ever. And I think we've proved it's more important than ever that actually we really still need that social connection, especially with our NMOs. So if we're feeling isolated, I think the thing is just to reach out, and chances are we'll be found.
Great. Did you, Jodarsen, did you have anything you'd like to say, or I'll continue on? We have many questions coming in.
Yeah. Just quickly, I'd like to add to how to deal with isolation. Is something that we have done very recently in our NMO is having support groups with a psychologist, group psychotherapies. I think that meeting with other people and sharing and expressing ourselves, taking all our fears out, our insecurities, actually has helped me a lot. You need to actually try to see the benefits if you've never done it. And we've also done it with other youths virtually, so it can be done virtually too. We had a psychologist with all HYA members online, so everybody was getting everything out, and we all felt much better after that session. So these are suggestions that I would give. You can try.
And Jodarsen, while we're with you, here's another question that's I think would be good for you to start answering. It's from Lesotho, and we touched a little bit on it before. You know, that many of us do have technology. You know, we have like apps, and we have devices like smartphones. But if you have members that don't have these things, do you have any advice on how you'd cater to those members that don't have these devices or don't have this technology at this time to help them take part in what you're doing?
This is actually a challenge that I have been thinking about how to deal with it. Some ideas that I have right now is maybe that if we need to give them information or share, we could pre-record and later get them the facilities so they can access those recordings. So this is how I've been thinking about it. Maybe if you have a friend or you have a common place that you can get access to a device, it will help a lot. So finding ways of how you can get access. People from the community trying to, for example, this very webinar is going to be recorded, and then we're going to upload it so it can be accessed later for people that are not able to join us right now. So these are ideas that I have right now. So
great, thank you. Because there's been questions which has been fantastic and a great level of engagement from the participants from all over the world. We're running a little bit short on time, so we have time just for one more question. And I think this one's from Oli, and I think it's a good one to end on for all of the panelists to answer and reflect on. And the question is, how could we work together to strengthen the global community of young people involved in bleeding disorders? And I'm going to add, at this time particularly, how can we do that? So how about Ed, I start with you, and we'll move our way down the camera again before we sign off. Remember everybody to unmute.
Yes, I just did that. You didn't have to tell me. Thank you. You know, that is a big question. And I think it is one of them that I know for me in my work in the programs that I do, is keeping people connected and being able to move the youth in a way that keeps them connected to the bleeding disorder. And what I found really in just my work with some of the young people from around the world, it is that push from other young people to raise their hand, to get involved in their foundations, to not be afraid to get involved. I hear a lot of times that, you know, people just, you know, they're happy, there's enough. They, you know, they don't need to get involved. And when I found someone did, when they actually looked outside of that thought process and they actually got other young people involved in their community. They became youth leaders. WFH is a great example of doing that. So I don't know that there's one simple answer, and I think some of the other panelists may have some ideas, being that they're young. But that's what I found. I saw that working the best globally is when young people got behind what was going on and saw that they are the future, and they're the ones that have to move it forward and take the baton in their hand and run with it. So that would be, from my perspective, what I would say about coming together and motivating and working with the youth in the community.
Great, thank you. Now, Salomón, what are your thoughts?
Yes. Okay, I think that the thing that really helped me to be involved in my community is meet the people that I mean. I'll be friends in Honduras, I make friends in different countries, and I enjoy to be part of the teamwork. I enjoy to have a good talk with them. And when you really enjoy your work, it's like get fun. It's not like a work job. So I think that engaged me. I think that's why I'm here. It's because I enjoy all the process. So if you are a new person, let me tell you that in the bleeding disorders community, there's so nice people, and you will enjoy all the process if you join.
Thank you. And Jessica?
I think the best way to know is to connect online. I mean, we've now got the infrastructure in place to have that connection, whereas previously a lot of us would not. And I think really that is our greatest strength now moving forward, is that we've cut down all those barriers. There's no passports or anything that we need to get anywhere. We can connect with someone, as we've proven this evening, and which is for me this evening, anywhere around the globe.
Thank you. So I'd just like to say and add my thanks to all of the panelists today. Salomón, Jessica, Jodarsen, who looks like he's had to leave, and Ed. It's been an absolutely fantastic session, and it's been great to meet some of you for the first time virtually as well. I'd also, of course, like to thank the WFH staff who always do such a great job, whether it's in front or behind the scenes. A big thank you to Stephanie, thank you to Zoe, and thank you to Louisa for your support for this webinar today. And finally, thank you so much to all of you who tuned in to listen to this webinar. Please encourage those in your community to go to the recording afterwards. And as we mentioned earlier, it is going to be translated into other languages to make it accessible to more people. So thanks again, and I hope you all have a wonderful morning, afternoon, or evening, wherever you are from all over the world, and have a wonderful time, and all stay safe out there. Thank you.